Good afternoon, everyone, and welcome to the new Eco Series Listening to Long COVID. This is brought to you by Health Confianza, a collaboration between the UT Health San Antonio and the San Antonio Metropolitan Health District. And please note that we are recording this session so we can share it later. But your names do not appear in the recording of the session, nor does anything listed in the chat. I am so glad to see you, and I hope you and your family doing well. My name is Raquel Romero. I'm a physician by training and working as a coordinator in the ECHO. I want to be the facilitator for the ECHO session today. And before we get started, I have some notes from the ECHO IT. Please stay muted unless you are speaking. These sessions are allowed for closed captioning. So to have access to that, please navigate in the bottom of your screen and you will see the show caption. Probably you need to check also for the more in the menu. If you need assistance during the session, please send a message to the ECHO IT. And we promote interaction in our sessions, and I would like to invite you and encourage you to participate in our session by adding your comments, your perspectives, and your questions in the chat box. And to help us with the right attendance, please enter your name, credentials, affiliation, email address in the chat. And please remember that no personal health information is allowed while we are discussing cases and scenarios. We are excited to announce that these sessions will have free continuing education credits for physicians, physician assistant, nurses, pharmacists, pharmacist technician, social worker, and certificates of participation for community health workers. Towards the end of the session, you want to see a link in the chat. Please click on that and complete the evaluation. A certificate is going to be automatically generated, but also a link that you can reload your certificate at any time. But please remember that this is going to be open until this Tuesday, 5 p.m. Central Time. For those that are new for the ECHO, ECHO stands for Community Healthcare Outcomes, and this is a model of life learning and telementorship. This series in long COVID explores the long COVID and the shared management strategies, including complementary approaches to delivering care. So we want to have a didactics, and then we want to have a panel, the experts, and then we want to have a video. And I hope you can join us for a total of 6 sessions that we have. I would like to take a moment to do the introductions and say thanks to the Confianza team. And I would like to introduce our team, and I would like to start with Dr. Rosenfeld.
Hi, good afternoon. Jason Rosenfeld. I'm an assistant professor at the Department of Medicine and the implementing director for the Health Confianza project. It's good to be with you today.
Thank you very much. We have Dr. Bergen.
Hi, everyone. Ruth Berggren. I'm an infectious disease specialist and a professor of medicine at UT Health and a member of the Health Confianza team.
Thank you very much. Joaquin Abrego is a presenter, didactics presenter.
Hey, y'all, my name is Joaquin Abrego. I am a community health worker and a community outreach coordinator with the Health Confianza team.
Thank you very much. I saw Dr. Berners earlier. I'm not sure if joined again our session, but I would like to say thanks to our ECHO team to make this session possible and to you all to be with us. Please remember that no personal health information is allowed when discussing cases and scenarios. And remember that ECHO is all teach on an environment. With that, I would like to now go to part of our agenda is didactics. Joaquin in charge for that didactics. Once you're ready, Carly is gonna present the slides. Thank you so much.
Hello, everybody. And so my didactic here is the Indigenous Approaches to Healing. And a lot of the experience that I will be relating to today will be coming from personal experience, or some of the things that I want to just kind of help you to get into the mindset of this is that I want you to open your mind to original peoples of this land. I would like to acknowledge that in where I am currently is San Antonio, Texas. The land currently was inhabited by a number of indigenous people. And so the indigenous people of this area used herbs, animals, air, water, everything from around here as medicine and to survive on a day-to-day basis. And some of those tribal people still exist today. Some of the tribal people that have existed today are the Tapilam tribe. A lot of them are the Payaya tribe, the Lipan Apache tribe. the Comanches and the Kickapoo tribe, and hundreds of other tribes amongst in the Texas area, including San Antonio. A lot of these places where you see the San Antonio missions, they were battlegrounds where a lot of the indigenous people lived and fought and used medicines. Next slide, please. So the disclosure, I want to just say that I do not have anything to disclose. I do not get paid by any outside companies or any insurance companies to give any of this. And as a person who works in the indigenous spaces and does medicinal work, I do not get paid to do any limpias, and I don't get paid to do any healing. So I wanted to disclose that because in the indigenous medicine world, that is very.
Joaquin, we lost your audio.
Can you try to connect one more time, Joaquin?
Yeah, should I
We got you
now?
Yeah, we
We got you.
Yeah,
You
so,
just finish closures. Go ahead.
So, okay, next, who am I? Oh yeah, learning objectives. In this piece, I am going to help to understand some of the basics of indigenous healing. I'm going to help understand the ways that indigenous healing can improve symptoms of long COVID and how to practice indigenous healing respectfully and aligned with the indigenous community. Next slide, please. So who am I? My name is Joaquin Abrego. I come from a small little town in Texas called Del Rio. I was raised in the smallest part of Del Rio in a neighborhood called San Felipe. My indigenous background is of Comanche and Kickapoo. I am a full-blooded Native American. I come from the area of South Texas in Del Rio, and my grandfather and my great-great-grandfathers all come from that same area. As far as practicing goes, I've practiced indigenous ceremony all my life. I was born and raised in a style of ceremony called the concheros. And so the symbol of my grupo is what they call them. The symbol of my grupo is called the shinashli. And you'll see that symbol on the left side. Shinashli is an Aztec word, Nahuatl word for the seed that germinates. And our group has always been a place where other people who are learning to become indigenous and looking for indigenous spaces where they can come and do that. You could see there at the Mission Espada, that's my family, that's my mom, my dad, my sister, and myself in the background. We are sun dancers, and we practice sun dance in the Mexica Conchero art form. And it is one of the most traditional versions of the Azteca dance. On the far right is my medicine man who has passed now. His name is Andres Segura. Andres Segura taught me everything I knew as a child, as I was needing to learn how to do medicine work as a kid because of my own need for healing, because I was sick early on. And if you look up Andres Segura, he was part of a documentary called The Eagle's Children. I would recommend watching it if you're curious more about his history and his life. Next slide. So learning to trust. I want to just make a quick point about this. So the top picture is a picture of a Native American boarding school. Native American boarding schools are still, they're no longer in existence today, but a lot of those structures and buildings are still up. They have been reused in a different way, like schools. They're using them for Airbnbs. I've been to one that was an Airbnb. Some people have turned them into hotels. They were these very, very big buildings. But as you can see, the majority of the people in that picture are Native Americans, but they're dressed like, they're not dressed in their native garbs. So one of the things that came from that was they were made to dress like what was the new settled or the new colonized area of the Americas. And so in order for them to live and to continue living and to survive, they had to do that. On the bottom left-hand side, you're going to see a picture. It's like an old picture done in like the Aztec drawing style of the people infected with smallpox. Some of the quick history is that when the Spanish came to Mexico and they wanted to conquer the land, the first thing that they did was give them smallpox, and they gave it to them in the form of blankets, and they were made sick with the smallpox, and the majority of the population passed away. They died from smallpox. And then on the right-hand side, you'll see a woman who looks indigenous. She has a very indigenous look to her, but the most important piece that I want to show is that she is missing a leg, and she is sitting on a wheelchair. So just wanted to kind of bring to attention that since the days of smallpox blankets and boarding schools, Native American boarding schools, our indigenous people have been trying to find ways to trust the medical system. And but to this day, we still struggle with access to healthcare, public healthcare, healthcare of any kind, medicine of any kind. Next slide. So I wanted to just kind of bring attention to what people, whenever they gentrify indigenous medicine, this is a kind of a joking slide where they say like the environmentally conscious bro starter pack. But a lot of this is what looks like when they gentrify our medicine. They're almost, it doesn't need to have any actual practice of medicine, but the look itself has allowed people to become part of those spaces. And so I wanted to just point that out real quick. Next slide. So when it comes to finding the middle ground between indigenous healing and current westernized medicine, I wanted to just point out here that you can see that in traditional Native knowledge systems, there's a lot of the communication for what might be ailing somebody, where they may be sick, or what their needs are, may be communicated in the forms of metaphors and stories, or connected to life values, and just behavior that was norm for them in their tribal areas. This continues to this day. This isn't not just history, but this is also present day. So there's also trust, inherited wisdom. A lot of people, when they're sick, will go to their elders or go to their curanderos first before they would go to the doctor, because these are people that live amongst them. They practice medicine amongst them and have shown healing before. In the Western science, you will see that that there is like limited evidence and explanation within the physical world and the spiritual world. And a lot of Native people find a difficulty in believing doctors when there is a disconnect in that kind of a way, where they believe there is always a connection between the physical and the metaphysical world. But some of the places where you'll find, one of the things that I wanted to point out, right, was that in the Western science, there is a quantitative written record and how they collect their information or their science and their research. It is proven fact through science that this XX number of people have experienced this, and that's how they will prove themselves. Versus in the traditional Native knowledge system, you will find that there is more need for qualitative and oral record. Well, I experienced this, I went through this, this is what actually happened. So this is why I trust the on that same level. So some of the things that match in the center here is that there is the common grounds is that the universe is unified, the body of knowledge is stable but subject to modification. Plant and animal behaviors are also stuff that people find there's a middle ground for practicing medicine. Also, positions of motion of objects, just the way that your body moves. That's common knowledge for Native folks, is that you listen to your body, and what your body is saying is where you may need that. So if there's pain in your arm, there's probably some kind of connection between your arm and your health system. So there's a lot of common grounds. Next slide. So I wanted to kind of point out some of the pictures here. So the importance of a limpia. So limpia in English is cleansing, right? Limpia is a word in Spanish. To limpiar is to clean, right? But they call them limpias because they want to cleanse your spirit. They want to limpiar tu espíritu, right? So that's just the way that they use it in Spanish. But the importance of the limpia is that it is cross-cultural. it is traveled throughout the world, and there is so much similarities in the practice that a lot of, not just indigenous folks, but African, Native, and Mexican people experience some of the same things. And so like the top right picture, you can see that there's a guy spitting, and somebody pointed out and saying, oh my God, you're talking about long COVID, there's a guy spitting. But I wanted to point out that one of the important pieces is that he's spitting rum. Rum is sugar cane, and a lot of African practices come from harvesting sugar. So they used a local plant medicine to help cure. And a lot of the rum, the spitting of the rum is asking for permission. But when we come to Mexico or even Texas, and South Texas area, sugar has always been used to cure people of susto, or when they've been shocked or scared. A spoon of sugar would be to help to kind of lower the amount of fright that you might be experiencing, or to kind of help you through the shock. The benefits of a limpia are that it clears a foggy mind. It helps you center focus. So when we talk about wanting to if you're freaking out because you are experiencing long COVID, the limpias are ways to like just center a focus, promoting better sleep, promoting positive outlooks in life, and lifting negative feelings and healing from emotional traumas and PTSD. So the other thing that I wanted to point out was that at the very bottom, there is a woman using a what we call a saumador, with smoke coming out of the saumador, and that traditionally is an Aztec practice. They use copal, which is a tree sap from a cottonwood tree. And so I wanted to point that out because right in the center, there is a woman doing a limpia with brush. And I want to focus on the brush because none of this has any ways that COVID or might exacerbate what you're feeling because of COVID, or might hurt your lungs or breathing issues. So we're avoiding the spit, we're avoiding the smoke, and we're just doing the brush, right? Next slide. So this is another starter kit, packet kit, but I wanted to show how now in the urban life of curanderos, and the urban life of indigenous people who may be Chicanos or Mexicans, or even people from other walks of life that began living in the United States. Some of these have been the go-tos for when they say limpias. And so some people say like, oh, just give them a 7-Up and Vicks Vapor Rub and they should be fine. Or, oh yeah, you can get rid of that with a shot of tequila. But I put here the mom from Coco, the grandma from Coco, because one, she looks just like my mom, and she looks just like my mom's mom, my grandmother. But one of the most important pieces is that we are needing to give attention to the illness, and these are ways that urban life, in our urban day, we have been able to find our way to give attention to what needs to be heard, to what needs to be touched, or what needs to be attended to. And sometimes our grandmother is the person who may be the easily to fall into that place. We can trust in our grandmother because she has the connections with the old ways, right? But there are medicinal practices and medicinal things in each one of these picture slides, you know. So next slide. How to. So of course, I also want to make mention that a lot of the ways that a curandero or a healer gets their start is by practicing all their life. On the previous slide, we had the picture of the grandmother, and the grandmother is at her older age now probably gives some of the best limpias ever. Younger folks are going to go through trial and error trying to figure out how all of this is done. So I'm not necessarily giving you a how-to, but I'm just offering the tools that are given from the earth that you can use to heal. The top left is rose water. Rose water has some properties that help fight acne, heal scars, soothe the skin, reduce redness. To the top right of that, you have the estafiate. Estafiate is a Mexican wormwood, and Dr. Bergen had mentioned some stuff around using wormwood if you're on medicine. So I just wanted to point that out, put a pin in that. But it's antimicrobial, anti-inflammatory. It treats minor wounds, burns, and bruises. helps regulate menstrual cycles, and is good for people with diabetes. Ruda or Ru is also an antibacterial. It's great for indigestion. It protects against athlete's foot and dermatitis. It helps calm the nerves and brings relief to arthritis and rheumatism. Rosemary improves sleep quality, stimulates health and growth. It's high in antioxidants, and it lifts the moods, and it helps better your circulation. It's also really good for reducing migraines and relieving from anxiety. So in the picture of the woman cleaning with the herbs, if you could pay attention to some of that, they gather these 3 herbs, 1 to 2 sticks, and they do this type of limpia where they'll either, depending on how extreme your feeling is, they will rub the herbs or they will slap the herbs. It just depends. If you're feeling very extreme, sometimes they will just Next slide, please. So I wanted to just kind of bring some attention to respiratory relief in indigenous ways that we do in some of the Native American ways. Next slide. So the stinging nettle is one of them. Now this is a plant that has traveled from different parts of the world and has found its way in Texas. The stinging nettle looks like a weed. If you look at it, you've seen these weeds before. They're all over the place. But a lot of the weeds that we experience in Texas are usually medicinal, and we call them weeds now because they don't look like regular. I mean, they don't look like our regular grass, and so when they grow in the middle of our yard, we're like, pull those out. But the beautiful thing about weeds is that if you don't pull them out correctly, they will grow right back. And there's your medicine. It's sitting all over the place, all over your yard. And so one of the things that I've learned that for like a gardening tip 101, right, is that if you pull out a dandelion and you leave it, it actually feeds back into your grass, right? But of course, you'll see more dandelions pop up. But anyway, dandelion is another medicine that you can use. So the stinging nettle is we use this in a tea form. You dry it, you crumble it, you steep it in a tea. It's really good for improving when you have respiratory issues. You want a temporary respiratory relief. You use this and it can help that. Next slide. The yerba buena is another one. Yerba buena is something that I grew up with. It was like some of the first go-to medicines when you're having a stomach pain or you have a cough. The yerba buena is a sweet-smelling spearmint, and but it has so many other medicinal healing. And so, but it's minty. You can dry it. You can use it moist. You can use it fresh. You can use it in recipes. It's good for eliminating infections. Some of the old ways was to chew it and to put it on wounds that where you may have an open wound. But we see those like in the adventure movies, but this was practiced pretty regularly in our indigenous practices. Next slide, please. Eucalyptus. Eucalyptus is, and it's not native to Texas, or it may be. There's versions of it that are native to Texas, but you can find this also all over the place. And the one important piece that I want to mention is that whenever you're looking for these herbs, it's always important to ask permission before pulling it from somebody's yard. This could be somebody's medicine that's growing. They could be growing this for intentionally to practice medicine. So wanted to just point that out because sometimes you see this, you look at eucalyptus being sold in flower bouquets and it's very expensive, and some people, they get very offended if you don't ask permission. Eucalyptus might be good for boiling, steaming, and using as a tea. It was similar to like Vicks Vapor Rub. You can use it to kind of inhale the smell. Actually, if you ever have fresh eucalyptus, it'll make your house smell like that fresh smell of eucalyptus. Next slide, please. So some of the health benefits of lighting a candle. So one of the big practices for us is, especially in the Conchero and Mexica practice, is to light candles. We do a regular candle. So once a candle is out, you start lighting a new one, and there's a whole practice. There's a permission ceremony. There's a whole thing that we're as growing up in the conchero practice, we practice these prayers that they last forever. So lighting a candle is a very important thing that has to happen in the house all the time as a member of the grupo. But so I tried to figure out the importance of the healing aspects of a candle, because I have found that this practice for me is very healing. And I talked to a lot of my family members and friends and people in the community, and they mentioned how they also keep candles in the house. So one of the benefits from lighting a candle is that you bring attention to your mental health. It's an opportunity that you get to be intentional about speaking to yourself and spending time with yourself. A candle in itself will create an ambiance, and it enhances the atmosphere. It promotes mindfulness. You have to pay attention when you have candles on. You bring attention to where your candles are. You want to make sure that you don't leave them on, or that the flame doesn't go crazy. So you have to be mindful. It's good for stress relief. It reminds you of the things that you prayed for. It reminds you for the things that you want to be intentional about. Say you don't pray. These are things that you want to be intentional about. So using the candle itself is a low light source. If you have headaches, you want to turn the lights off. The candle is a low light source you can have on. Right. So we talked about, if you're practicing speaking intentions, positive intentions for yourself, you're constantly putting to practice that you want to be well. And it's a positive self-motivation in the form of what people might understand as a prayer. One can practice improving your daily moods by practicing this on a regular basis. Next slide. Now, this is one that I always feel like people always bring a joke to, especially in San Antonio, because this is one of the more popular versions of a limpia, but they call it the spiritual egg cleanse, or they say there's a joke that says, I'll be fine. My grandmother can clean me with a huevo, right? Or they'll clean me with the blanquillo. And so that's the joke. But the truth is that this is an old practice for the indigenous community. It's also an old practice for Mexican American and Mexican communities. One of the reasons that it is important is because it is a holistic method for centering of focus. You're setting, again, positive intentions. You're helping to relieve hidden burdens and negative thoughts. This is also the opportunity that you get to spend time with a person who might be a spiritual leader. And so then you can allow them to help to remind you that you want to be well. The egg itself will gather body temperatures. And it shows here the person holding the hand with the body temperatures. But as we know, when we're close with other people who have high body temperatures, we also will raise our own body temperature. So the egg is used to sweep the body. They actually put the actual egg onto the body, and they'll sweep the body like in the limpia motion too. And then you speak the intentions. You crack the egg in a crystal clear glass, and you observe how the body of the egg, how it might have changed. The darker colors usually mean that is a release of trauma and negativity, and the lighter colors will mean that you're releasing of anxiety and stress. Now, whether people believe this or not, the intention is where it's important to understand. When people see the egg cracked open and they see that the darkness of the egg has come out of the egg, some of this is so important to people as it relieves that stress and that trauma. They will begin to practice self-motivation. They will begin to find center of focus. Next slide. So this is my last slide, the sweat lodge and the willow. So the willow tree is used to build a sweat lodge ceremony, and these sweat lodges can only be run by people who have permission to run these sweat lodges. The thing that I've been told was that if you build a sweat lodge, you are the sweat lodge. So you cannot just build a sweat lodge and then just be, out in the world without knowing that your body itself becomes a part of the sweat lodge. And so anybody that you bring into the sweat lodge, you have to remember that you are also part of. So that is a lot. That is a lot to carry. So only certain people, special people, are allowed to build sweat lodges, and that's if they continue the practice of a healing and growing in a healer fashion. The willow bark itself, there's a variety of willow trees and willow bark, but the willow itself has been used for centuries as a pain reliever. The active ingredient in the medicine in the willow bark is the salicin. I don't know how to pronounce that, but But it is basically just like what the indigenous people have said to be the natural aspirin. So they build these sweat lodges. They cover them with blankets. They cover them with tarps. They make it very, very tight to the point that no heat can escape from this. You can see there's a little section where they put a heat. They build a fire. They put heat rocks, special rocks that heat up. And the person who runs the sweat lodge will know which rocks to find. They heat those up, they bring them into the sweat lodge, they put them in that hole right in the center, and they pour water. The water usually has eucalyptus, it'll have yerba buena, or it'll have some of the other medicinal plants that we've talked about in the water that have been soaking like a tea, and they pour that on the hot rocks, and it steams and it smells so amazing. But it is hot. It is hotter than a sauna. I mean, it is so hot. So not only are you experiencing this very intense moment, but it is returning as if you are returning back into the womb of your mother and you are being reborn into this. And so this is how a lot of indigenous people will heal very, very heavy ailments from the community. And this could be done with one person in it. So so if people are afraid to spread COVID, this is still something that can be done on a level where one person is allowed in the sweat lodge. And so it frees the mind of distractions, it offers clarity, it allows for introspection and connection to the planet and the spiritual world, and it literally will make you sweat out everything that you have, all the toxins in your body. It's very intense heat. Any questions?
Thank you very much, Joaquin, for this presentation. Is there any question from our audience to Joaquin at this point? You can think also on the question and put in the chat if you like. But at this time, I would like to use this space to ask Dr. Rosenfield, if you please introduce the video as a part of our agenda. Now we have a video, and Dr. Rosenfield, end your time.
Yeah. Thank you again, Joaquin, for the presentation. I'm sure there's lots of ideas bouncing around, and I've got a question that I'll pose to both you and Dr. Berggren at the conclusion of our storytelling today. So again, as a reminder, in lieu of the case discussions for this Echo series, we are providing stories from our community of individuals who are struggling with and living with long COVID. And so this is our way of beginning to understand and listen to people's lived experience, not necessarily, as Joaquin said, the quantitative measurement of illness, but the qualitative measurement of people's experience, both having illness, but also within the healthcare system. So with that said, I'd like to go ahead and cue up the video for today.
Never struggled walking before in my life, and now I could barely walk. I could step on a step. I used to be able to step on like a regular step fine, with all my strength, and now I have to hold on to something to pull myself up. Never experienced that before. Maybe like you said, the symptoms takes about 7 days until you feel it. So after the 6th day, that's when I started feeling like I couldn't breathe. And so after that, it just, my health went downhill. I got admitted to the hospital. They put me in a coma. I was in a coma for 2 weeks. I woke up. I had no body strength. It felt weird because, I've never experienced that before. And when I first woke up, my first therapy session, I sat up and I went straight back. I had no control of my body. It maybe took a week, maybe a little less than a week to finally get up and have a little bit of strength. And then next day, that's when they started, having me walk, and I couldn't do it the first time. It took like 3 tries. And when I finally did it, I was able to walk around the room, but it was a struggle. It was a big struggle. Even when I left the hospital a month later, I still had to learn how to walk. We have a 2-story house, so my kids, one would walk in front of me, one would walk behind me while I climbed the stairs to go up. Make sure I didn't fall backwards, didn't fall forward. My daughter, she took care of me. They stayed home from school. They would take turns staying home from school to make sure I was doing okay. They would cook for me, just take care of me. My wife, same thing. She would stay home from work, and probably like 6 months after I was released from the hospital, I started noticing some symptoms where I had trouble holding my balance. I couldn't stand still. Muscle weakness. I couldn't climb a ladder. I couldn't lift my body weight at all. Just having issues. Just like numbness in my hands, feet. I guess back then at work, I'm a plumber, so we do like a lot of heavy lifting and all that. And so before I got COVID, that was easy for me to do. And recently, in the last 3 or 4 months, it's been a real struggle, because I'm not able to use my legs like I used to before. So, and I still have shortness of breath, and it's just, I'm just trying to get back to the way it was, but it's just affecting me a little bit right now. Don't give up. Don't give up on them, because the professionals that worked on me, they saved my life, and just don't give up on them. Like I said, I was being hard-headed, and I'm glad I had to be restrained when I was at the hospital, because I was putting up a fight. So I'm grateful that they did that to me, because if I didn't do it, they already had told my wife, if we don't put him under, or we don't get him intubated, then he's gonna die, because I was struggling so hard to breathe, to catch my breath. I couldn't, and they said that eventually I was gonna lose oxygen in my brain, and all my organs were gonna fail one by one. So, I don't regret anything that they did to me. So, I just got over COVID again. I just had it 2 weeks ago. I was in the hospital for 6 days, and the only thing this time is I didn't have to be induced to a coma, because I had the shots, and the only thing that I was experiencing was a little bit shortness of breath. And so before it got worse, I went to the hospital to make sure they can keep it in check. And so they gave me all this stuff, and then of course I had pneumonia again in my lungs. So I just recently got out about a week and a half ago. Starting to take care of my diabetes, manage that. Hopefully, it helps me with healing with the long COVID. And
I want to just start by thanking Chris and all of our other storytellers for sharing their stories with us. And for those of you that have been in these rooms with us before and sharing your stories, we're so appreciative. I'd like to just kind of start with my general question to the group here. What did you hear in this story? What did you observe in this story? Are there any themes that, for those of you that have been with us on multiple occasions, themes that you're starting to hear emerge from the different stories we've had so far? Please feel free to unmute or put your comments into the chat. So I can maybe try to get us started here about thinking back to a little bit of what Joaquin was sharing in his presentation, and trusting relationships. Did anybody hear any issues or concerns or themes around trust and Chris's story today that emerged for them?
Dr. Rosenfeld, in the chat, it says normally healthy people are experiencing side effects of COVID-19. That's for the question earlier, and the many and real struggles for long COVID.
Yeah, and to Lisa's point there, appreciate that. It's that comment that Sharon just says, don't give up, right? I think we've heard that from all of our storytellers so far, is don't give up on us, keep listening to us, and please don't give up. Thought I saw somebody unmuting. If I did, please feel free to share.
Hey, Dr. Rosenfeld, it's Joaquin. I wanted to just offer a piece. One of the things that I really love about watching Chris's video is that his language. Chris is probably a third generation United States American. He doesn't speak, his first language is English, and there's just like there is like this the way that he explains his situation is so important, because language is definitely important to how we communicate with the doctors. And there was a lot of things that he kind of stumbled over in speaking of the way he spoke about healthcare. And so I thought that was so important, and I think that's important. That's why it's so important that these videos are shown.
Yeah, thank you, Joaquin. Jasmine, I see you threw your thumb up. Would you like to also share? I know you unmuted.
Yeah, I was just gonna say, like, that's the importance of, like, even how we were raised. Sometimes we were raised like not knowing that not to trust the doctors or not going to the doctors. And so I noticed he had said that he had to learn how to trust the doctors. And that's something that, as a community health worker myself, like, we have to think out of the box, right? Not just look at the picture itself. We got to remember that we are all raised different, and we are developed in different perspective, and we grow differently. And so that's something that stood up to me. Definitely.
Yeah, thank you, Jasmine. I really appreciate that really pulling that piece out. He had to learn to trust the doctors. So one of the next questions I have is what can we do, whether we're clinicians, whether we're medical assistants, community health workers, public health professionals, pastors, or otherwise, what can we do? What are the strategies that we can employ to help build, rebuild, and sustain trust in our healthcare system? What are some successes that people have had that they'd like to share? Or ideas? Yeah, Eddie.
Okay. For me, one of the things that I had to deal with was I always felt like I was rushed whenever I went to go see the doctor, and I'm trying to grasp with all the stuff that I'm dealing with. And, the doctors have all these patients outside, and you're like feeling like you've got to hurry up and get out of here. And you're dealing with brain fog, and you're trying to think of the words that were so common to you just a few weeks ago, and you can't think of them in either English or Spanish. And it's frustrating. And like I said, you can see the staff is in a hurry. You hear them out in the hallway and everything else. And so I think that it just added to the frustration that I was dealing with, of having to go to several different people and tell the story all over again, and kind of getting the same looks of like, yeah, okay, And so that's the other thing that for me was making me feel hopeless at some points. So I don't know if and I could see that there were other people that were dealing with different things, but I didn't know where they were. But for me, it was like, I'd walk in and with some hope sometimes, and then when I'm on my way home, feeling really even more hopeless than when I first walked in.
Eddie, as always, we really appreciate your sharing your stories with us. I can imagine how frustrating that has been for you. I do want to recognize a couple of comments here in the chat, which I think can help us kind of keep this conversation going. So Joaquin talking about inviting the community into medical spaces. I would even argue inviting the medical spaces into the community, whatever that looks like, however we achieve that, and then sharing knowledge with generations, and also just understanding other ways of knowing, which I think comes back to your presentation, Joaquin, is there are many ways of knowing and experiencing the world, and we as healthcare workforce need to be open to those ways of knowing and not passing judgment just because it does not fit within maybe the training that we've been provided. And then finally, I want to say what Sharon put, taking control of other illnesses, recognizing the comorbidities, having one illness on top of another. I wanted to quickly ask this question to Dr. Berggren as one of our resident clinicians. What are some of the strategies that you have found successful in building and maintaining trust with the patients that you've served?
So thank you for that question. And in the context of today's topic, I think it's really important that clinicians find some time to, especially when they're first meeting a patient, they don't have a pre-established relationship, to understand the perspective of that person, understand a little bit about where they're coming from. That might take a little bit more time than usual. I call that front loading. The first time I meet a patient, I'm going to be willing to spend a little more time with them than the short time that's allocated for most patients. And in the course of that discussion, there doesn't need to be a particular script for it, but it's important to allow the person to feel comfortable in revealing important things about themselves and then asking some specific questions. So one of the questions that I might ask is, do you take herbs or supplements? And that's critical. And I may not know what an herb is. I may not have any idea what something is that someone's taking, but I'll take note of it and I'll say, listen, thank you so much for letting me know about that. I'm going to do a little research and get back to you about whether I think there's any problem with this supplement or this herb that you're taking. We know, for instance, that things like St. John's wort, that is an herb that people will take for depression, has drug-drug interactions that can be significant. Joaquin was mentioning wormwood earlier today. That's another one where there could be potentially serious drug-drug interactions. So, but for me, the critical thing is not to be dismissive or in any way shaming, because that's only going to cause a person to shut down. I want to be able to have an environment of respect and trust, and then get back to a person if what they're bringing in from a different practice than traditional Western medicine, get back to them about how those two interact and make sure there's no harm.
Yeah, thank you, Ruth. And I want to just quickly highlight a piece that you said and then open this back up to the group, which is if you're asking for information and you say you're going to go do something, make sure you bring it back, right? It's like, this is a principle that we always talk about in global health and community engagement. I'm going to ask you something, and if I don't answer the question at some other point in time, then I've let you down, and that is reducing trust. It's going to make people less likely to share and ask you those difficult questions. Anyone else want to unmute or put some comments in the chat about building trust, whether it's in a clinical environment, in a community environment, and in any environment for that matter? What are anybody's comments or thoughts now, thinking through Chris's story that he just shared, as well as any of the other stories that we've heard over the course of the last 4 weeks, including Eddie's, who shared his story here in this room? What are people's reflections on the role of traditional healing and medicine in any of these stories? Were there opportunities that we think that we could have integrated other ways of caring to help individuals that have shared their stories? Got a quiet, very reflective group today. Yeah, Raquel.
I would say maybe, as I was mentioned, just listen. Right? Just listen and feel empathic with the information that we're receiving too. Going back to the point of Dr. Bergen mentioned about the trust and respect, so that any information is so valuable, and we will have the need to be heard. Is anyone that would like to share something in that regards, or in another point that you think it would be important?
I think too, I've been reminded of the importance of everyone else who might be connected with that patient who's not a patient, that's a person. And I've been really moved by the stories of caregivers that we've heard in these spaces, or caregivers who might be individuals or just entire communities surrounding a person to give them support. I think it's valuable as a healthcare worker to recognize the other assets and strengths a person might already have with them that you can tap into.
Yeah, and I just want to put a plug in for next week's, because our story for next week is another caregiver, and it's a very powerful story. So I hope that everyone will be able to rejoin us again. This also brings me to a question that I wrote down as Joaquin was sharing his presentation, particularly the picture of the overlapping circles in the Venn diagram. And so part of what Joaquin mentioned was the importance of metaphors and stories within traditional healing practices versus the quantitative side within medicine. So my question, and this is a common question we keep asking, is what can we do to elicit those stories in a successful and an honest, respectful way, so that we can understand people's experience with both life as well as illness and healing? Joaquin, do you have any kind of reflections on that for our community of practice here? What are some of the best ways to respectfully ask for somebody's metaphor or story without necessarily asking for their metaphor or story, how they can frame it in a way that we can understand their experience?
I think one of the points that I wanted to make, and I put this in the comments, I put, if you trust the people become trustworthy, right? And that can go in the opposite way too, right? If you don't trust the people, then the people will become untrustworthy. And so like, this is on the responsibility of the person listening, right? If you are listening to a patient talk about the metaphorical story, how are you listening? What does your face look like? What kind of body language are you giving? How are you? What is it like? What are those first moments of doubt? And I forgot to mention at the beginning. Like, I wanted you to pay attention to your own doubt. How are you doubting what was being told in the presentation today? How are you doubting what people when they speak? How are you already creating these biased stereotypes and that kind of thing, right? So like, when you're listening to people, are you showing that doubt? Because then that will place in a practice that they will not trust. People will see that, they will see your and so I think, in my own opinion, is that if you practice releasing that doubt, right, you will begin to listen in a way that people will begin to trust you, right? And I mean to throw this out there because the narrative is, for a lot of communities, their language is different. And so when they may say something that doesn't make sense, do you automatically go like, wait, that don't make no sense. Like, I think you're saying that incorrectly, right? Or are you listening and maybe channeling in what you may think they're trying to say? And how is your face and your body reacting to all that? And so I wanted to just offer that piece because I think it's very important that we learn to listen. And what does that look like? And what does that look like qualitatively? What does it look like quantitatively, right? If a doctor's saying, well, 30% of the population, blah, 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 do we think, oh, of course, that doctor's correct because they went to school? And a person says, well, I had a vision of God last night, or I had a vision of my ancestors, and they told me I would be getting sick in the next couple of days. Are we looking at that and saying, you're crazy? But you're probably getting sick. So it probably, so how did you listen to that? How did your body react? Did you have doubts?
Yeah, and I appreciate that. Sorry, Raquel, go ahead.
Yeah, and as I just a little bit more in that context, it takes time, right, to build this trust and then keep trying and listen. And there is a message, actually, it's in the chat. It says time with the physician is important. Also establishing therapeutic relationship with your primary care provider. This requires routine periodic visits. So coming back again with questions, and if we don't get the answers, come back again and talk to the doctor again for questions that we may continue having.
And Magdalena has like summarized our entire health literacy echo in one chat submission. Paying attention, active listening, respectful listening without judgment. And then Ruth, Dr. Berggren added the key final piece, which is our body language. How are we actually reacting to people, not just with our words? We say as much with our eyes and our eyebrows and our body as we do with our mouths. And so how do we, as Joaquin is saying, present ourselves holistically to demonstrate to people that we actually hear them? And I would just want to reflect quickly. I was just teaching a course this morning with some of our medical students on health inequities, and one of the key themes that emerged from our conversation is just get curious, right? This curiosity about people and their stories. I think about my children who are 8 and 6, and they just keep asking questions. And I think that is, if we can find that inner child in us sometimes to just ask the additional question about what it is we're hearing from the patient or the individual in front of us, oftentimes acknowledging that in that way helps people be seen in a way that we don't always see them. We have about 2 minutes left. Any last comments or reflections?
I think it was one comment earlier about family support, that this person has a family support. Support is so important for people around us, right? Just to make us feel better and keep moving and keep going. As I was mentioned, respect and trust, no verbal communication.
Yeah, I think we've heard that in all of our stories so far, is that a key member of the healthcare team is families and loved ones in each of these cases. And again, as a teaser for tomorrow's or next week's session, our story comes from a caretaker, and it's not just the need to understand the support system around each individual who has or does not have a long COVID diagnosis, but to find ways to also listen to those individuals and what they know about their loved one and their experience with illness. That observation, that intimate relationship is just as important. Well, Raquel, I think maybe we can bring this to a close. I think we've had a really nice conversation hitting on similar themes around acknowledging perspective, helping to build those trusting relationships by listening to people, seeing them for who they are, and acknowledging the cultural practices and the context in which they come to our healthcare system with. So thank you all for your participation.
Thank you so much for these remarkable points. Dr. Rosifil, and as it was mentioned, please stay with us next week. Put them in your calendar. We're going to have a very good session, and I hope you can join us. In terms of the CE, the information is in the chat. Please just follow up the steps, and you're going to get the credits. But until next week, you have a wonderful time and enjoy this beautiful weather.